Here we have an orthopantogram, OPG, of a young adolescent, and the first thing I notice is a well-defined, unilocular, rounded, cystic lesion in the right hemimandible. It's measuring around 2 to 3 centimeters in diameter and is located between the roots of the lower right 5th and 6th teeth. Both teeth are displaced laterally, which is a key feature, but importantly, there's no root resorption noted. The narrow zone of transition between the lesion and the surrounding bone, along with a thin sclerotic rim inferiorly, makes me think this lesion is benign, slow-growing, and relatively well-contained. There's no evidence of cortical breakthrough or aggressive bone destruction, which further supports this. Now, in a case like this, the differential diagnosis typically narrows down to 2 main contenders: keratocystic odontogenic tumor, KCOT, and ameloblastoma. Given that the lesion is unilocular and located in an area associated with tooth development, KCOT is the most likely diagnosis, especially in a young patient like this. KCOTs are well corticated, expansile, and have a high recurrence rate if not thoroughly treated. Ameloblastomas, while also possible, tend to be more aggressive, often causing root resorption, which we don't see here. The next step would be further imaging, potentially a CT scan, to evaluate the lesion's full extent and to confirm cortical thinning or expansion. This would help guide surgical planning, as complete enucleation and curettage are required to minimize recurrence, particularly for KCOTs. In an exam setting, you might be asked to differentiate between KCOT and ameloblastoma. The key points to mention would be the relatively benign nature of KCOT, the typical absence of root resorption, and its high recurrence rate if incompletely excised. In contrast, ameloblastomas tend to be more aggressive and can cause root resorption or cortical destruction. So, wrapping it all up, this is most likely a keratocystic odontogenic tumor in a 13-year-old girl, and the next step would involve surgical management to prevent recurrence. If you found this helpful, don't forget to hit that subscribe button for Radiology Made Easy. Let's keep learning radiology together. Catch you in the next case.